Dear ladies and gentlemen, this is day 195 of the full-scale invasion of Russian Federation in Ukraine. My name is Andriy Shevchenko. On behalf of Mediacenter Ukraine, I'm welcoming all fellow journalists who are sharing the story of our fight for freedom. Our guest today is Lesya Kobetska, head of the Healthcare Directorate of Lviv City Council. One of the reasons why we are going to talk about the peaceful medicine in wartime, this is coronavirus. Because during the wartime, we have one unfinished battle. This is the coronavirus that is poisoning our life for the last 3 years. Today, we are talking about the new wave of coronavirus disease and what can we expect this fall. Ms. Lesya, please fill us in on the details, how correct it is to talk about the new wave of coronavirus disease. Good afternoon. Unfortunately, COVID-19 did not cease to exist. We just took a pause, a relatively quiet pause, but since early August, we have been experiencing the growing number of patients who contracted this virus, COVID-19. In early August, there were quite a lot of patients who were hospitalized. The figures are the following: 16 in early August, next week 36, and the next week was 72. The biggest number was 122 patients who were our inpatients. These are, let's say, medium condition patients, and they required in-patient care. Speaking about outpatient care, the patients who are taken care of at home as outpatients, so altogether we have 900 patients registered who contracted coronavirus and recovered since early August. These are mostly the patients who had mild form of this disease, mild symptoms. Let me remind you that COVID resembles acute viral disease, but it's meaner, it's trickier, because it can cause complications and it can trigger complications of those diseases that the patient had been suffering as from chronic diseases. So this is the third fall in a row that we see the figures growing. So can you compare this wave with the previous two waves? Of course, the previous two waves were harsher, and we even felt that our medical staff is getting exhausted, and the number of deaths unfortunately grows, so the death toll grows. This is the beginning of a new wave of COVID-19, but the disease is milder. We have 15 patients, unfortunately, who we lost, but those patients had underlying chronic conditions, all of them. 50% of all those who contracted the virus are non-vaccinated patients. So let me just emphasize that the patients who were not vaccinated with the booster dose, and it was recommended by the Ministry of Healthcare, unfortunately they neglected this recommendation. After the vaccination, our body develops antibodies that protect us from coronavirus disease, and thus it's either a milder form that you can have, or you can go without contracting this disease. So my emphasis is, please get vaccinated. It's the only salvation. If there are any questions from our guests, please let me know. What strain are we talking about? Omicron is the strain that we are experiencing right now. Of course, it mutates. It mutates into new different strains and forms, but all of them are more or less similar, and it resembles, as I already said, acute respiratory disease. So this is sore throat, muscle ache, some patients lose the sense of smell and taste, and other typical symptoms. I believe we have a question. If so, please take the mic and ask your question. My name is Victoria Hetze, Lvivska Хвиля Radio. Is there a Johnson & Johnson vaccine available in Lviv? Yes, it is available. It was manufactured by Belgium company. It's a very good quality vaccine that had been used in Europe. Only a month ago, we received this vaccine, and I do recommend our patients to get vaccinated if you haven't been vaccinated yet. It's very convenient because you only need one shot of this vaccine. And after 6 months, you can take the first booster dose. And if we're talking about the second booster dose, it's 4 months after this. What vaccines are available at the moment and what are recommended? So there are 3 vaccines that are available. So this is Johnson & Johnson, Pfizer. However, we don't have enough of Pfizer. We are running out of it, of our stocks. But due to recent information, I believe that in 10 days or so, we are expecting the new delivery of Pfizer vaccine, and the patients can take another shot. Also, we have CoronaVac vaccine, and so you can take a booster shot with Johnson & Johnson, Pfizer, and Moderna, but unfortunately Moderna is not available. My name is Irina Vashchishin, Channel 24. What are the vaccination conditions? Where can patients get vaccinated? Are you going to deploy vaccination stations all over the city as you did during the previous wave? You are right. Last year we had special vaccination points or stations. We located them in big shopping malls, and it allowed us to vaccinate a lot of people in Lviv. We have our clinics, and in each clinic there are surgeries where you can get vaccinated. So basically, vaccine is available in all clinics, in all neighborhoods of Lviv. Whether we are going to open more stations as we did last time, I believe that there is no need to do so because vaccine is available in clinics. And I believe because of the war, it doesn't make any sense to open additional centers. Are there any other questions? Another question for you. Are you planning to introduce mask regime again in Lviv? I believe it makes sense because once we see the growing number of cases, it does make sense to introduce mask regime in public places, especially in public transport, because of proximity, because of the risk of close contact. On top of that, I would recommend that people take it as a rule, as a ground rule. So they should take care of personal hygiene, wash their hands in order to make sure they do not contract this virus. Plus, keep the social distance. That's another recommendation. But mask or respirator definitely will protect you from contracting the virus. Is the city planning to introduce other restrictions? Today we had a special meeting in the city council, and we were talking about vaccination. As far as special restrictions are concerned, I believe that maybe we will discuss it next time. Today we haven't touched it yet. There is no need because there is no dramatically growing figure of cases. I'd like to ask a broader question because I'd like the journalists all over Ukraine to understand it. From what you see in other regions, do you believe that Ukraine is now going through a new wave a new consecutive wave of coronavirus. I believe it is so. It is considered to be a new wave of coronavirus. However, it's not as acute as the previous waves. I hope that there won't be the splurge, but I have to emphasize that this virus is tricky, it's mean, and it's similar to flu or acute respiratory disease, but still it's more serious. Are we talking about all Ukraine, or are we talking about the new wave all over Europe? It's hard to say because the situation is not that harsh in Europe as far as this new wave of coronavirus is concerned. I believe that this is just the beginning of the new wave. We've been watching what was happening in Chernivtsi because this thing always started from Chernivtsi. We know that they have registered a new strain of Omicron virus and they have a bigger number of cases in Chernivtsi. However, it's not as acute as it was during the last wave. My other broad question about coronavirus is the following. When people who do not have medical qualifications ask you a question, are we ever going to get rid of coronavirus? Not this fall, but maybe in the future. What would be your answer? If we compare all waves, all previous waves, I believe that this wave is not as serious as previous waves because of vaccination, thanks to vaccination. 70% of our people have been vaccinated with the first dose, 67 with the second dose, and 8% have taken the booster shot. And 3 weeks ago, we started vaccinating some patients with the second booster dose. So we've got 240 patients so far who had taken the second booster dose. I think that we can get rid of this virus provided we are fully vaccinated. So as many people as possible should be vaccinated. In that case, yeah, we can overcome this virus. Do you think that Lviv medical facilities cope with the additional load related to a bigger number of evacuees that arrive in your city? Our medical personnel had difficult times last year. Unfortunately, this year we are all experiencing the war, but we are coping. Our medical staff was coping with the big number of internally displaced people because they were providing care to them. We provided care 24/7 because there were a lot of patients who reached out to us, those who were trying to escape the war. Now we are doing the monitoring, and we know that our IDPs, they live in module towns, in other cities. We invite them to sign the declaration with our physicians, with our family doctors, if they don't have any, because we understand that such patients need not only medical care, but also psychological, mental health care. By the end of the year, we are planning to open mental health care centers in each clinic, Lviv-wide, where we are going to provide help not only to Lviv residents, but all those IDPs who ended up here. Are there any other questions? Are hospitals, Lviv hospitals, ready to the new wave of coronavirus? And what is the hospital capacity? How many patients can you hospitalize just in case? Thanks to COVID, unfortunately, I have to say like that, our medical facilities, our hospitals had to introduce some innovations and to upgrade their equipment, artificial oxygen machines. We have 3 hospitals, St. Pantelimon, St. Nicholas, and the 5th municipal hospital that is providing care to adult population. St. Nicholas Hospital is providing care to children. We've got 1,300 beds for COVID patients. We also have ICUs. We have 115 beds in ICUs. So these are the beds for patients who have severe condition. We also purchased artificial lung ventilation machines. 75 machines have already been in use. We have oxygen supply machine next to each bed, which is now much better situation than it used to be. And we also have oxygen concentrators. Thanks to the Ministry of Health, who provided us with the oxygen concentrators for the patients who are sick, but they are taken care of at home. So they need oxygen therapy, and they can take this therapy at home because they are outpatients. Our guest was Lesya Kobetska, Head of Healthcare Directorate at Lviv City Council. Thank you very much for visiting us and providing this information. Our next briefing is going to be in 10 minutes. Our guest will be Serhiy Bilenki.